Hello everyone, in this video we are going to discuss about hemoglobin electrophoresis. So when we perform hemoglobin electrophoresis on a cellulose acetate plate with pH of 8.4, there are two things, that is cathode and anode. Whenever a negatively charged thing is there, it will move towards a positively charged anode. So whichever hemoglobin is having the most negative charge will migrate the farther. So this is the dictum of this electrophoresis. So let us see. In first most farther thing, the most fartherly moving hemoglobin is the HbA, because it have the most negative charge as per the dictum. And next one is the HbF. It have a less negative charge than a HbA. Next is HbS, D and G. This is because during missense mutation there is a replacement of the glutamic acid, negatively charged glutamic acid, by the valine. It is neutral, so it is less negatively charged than HbA and F, so it moves less farther. Next is HbA2 and HbC. In HbC, it is the glutamic acid is replaced by positively charged lysine. So it is very less negative and more positive than the HbA. So it moves least distance than any other hemoglobin. So the order is HbA, HbF, HbS and HbC. So here in a normal adult we will see HbA the most in a large amount, so it is a normal adult. In newborn we will see HbF along with some amount of HbA. So this is a normal newborn. In sickle cell disease we will see HbS predominantly, but there is absence of HbA. So it is sickle cell disease, and in sickle cell trait we will see HbS along with HbA. In HbSC disease, here what happens is there is both HbS and HbC, both are present. It is AFSC control, means all are present, so it is a control panel. So this is the hemoglobin electrophoresis. So let us solve a problem, clinical MCQ based on this. So in first patient what we are seeing is the order we have seen is HbA, HbF, and next there will be HbS and HbA2 or HbC. So this is the order. So here the normal order is present, HbA is predominant, so it is a normal adult. So this is the normal adult. Here we are seeing some amount of HbA is reduced along with normal HbF with increase in the HbA2. So this is beta thalassemia trait. So this is a beta thalassemia trait because there is HbA is reduced along with HbA2 is increased. So this is beta thalassemia trait. And next question, here we are seeing HbF very much increased, HbA is very much decreased. So HbF is increased, HbA is very much reduced, and along with HbA2 which is increased. So this is beta thalassemia major. So what is the difference between the trait and the major is in beta thalassemia trait HbF is almost normal. So but here in beta thalassemia major we are seeing very much increase in levels in the HbF and very much decreased levels in the HbA. So next, this is HbS. So if HbS is present, we have to think of sickle cell. So sickle cell disease or sickle cell trait, we have to differentiate between this. Here HbA is still present. So if HbA is still present but reduced, then it is HbS is present. So this is sickle cell trait. Here HbS is present but HbA is absent. So this is sickle cell disease. So by knowing a simple electrophoresis diagram, we can actually diagnose a lot of conditions. So a lot of MCQs also. So we have to remember only one dictum is most negative charge will migrate the farther. The order is HbA, HbF, HbS and HbC. So this is hemoglobin electrophoresis and MCQs based on this.